interesting. So what I will presenting is the health benefits of open streets, so ciclovías recreativas. That is something, urban intervention that is very common and originated in Latin America. So, and this is a project that started in 2018 and I finalized it in 2020. I'm based in Colorado State University, and this project was coordinated also with partners in the IS Global Barcelona, the Global Health Institute in Barcelona. But that includes 10 different countries in Latin America and 15 different cities. And the topical issue addressed for this project is transport and cities. So there are different type of stakeholders that were involved in this project. I will explain you how was the process, but very important that this is a stakeholder originated project. And this is under the request of NGO cyclists or bicyclist NGO from Quito in Ecuador that actually opened the demand and help us to collect a lot of data across the Latin American region. And the funding came from the European Union Horizon 2020. So I don't know if you're familiar with what is an open street or a ciclovía recreativa, but it's a very common intervention in large cities and now exists in many cities in Latin America, but also exists in North America and even in some countries in Europe. So the general idea is that to close major roads, major streets in the city, and to change the use from cars to pedestrians, cyclists. So normally they close this on Sundays or holidays. So in some cities, this is very successful intervention and open the city or the built environment of the public space to new uses, and especially in those days that there is low traffic densities. So and encourage physical activity. So in this specific case, the intervention helps to mitigate climate change. So and helps to promote active transportation or physical activity. So substituting motorized vehicles for physical activity or active living is really important, and the reduction of greenhouse gas emissions. And the promotion of physical activity is one of the main reasons that this intervention exists, to try to attract people to do more physical activity in urban environments and to provide this space where they feel allowed to actually use the bicycles and without risks of traffic injuries and fatalities. So, and encourage to actually perceive the city in different way, to actually perceive distances in different ways. So when you actually are able to use these main streets or roads in your city and figure out that actually distances are not so big and you can do that by bicycle, probably change your mentality and your perception of the city. So what we did is a quantitative health impact assessment of the open streets. And what we overall we found is that actually the benefits of those open streets are very important, and most of the benefits we quantify based on the physical activity performed in those open streets. And we also find that cycling is the most common physical activity that was performed across the 15 different cities. So in this map, you can see the different countries and cities included in this study. So as I mentioned before, that was a demand from an NGO that is, the name is Ciclopolis. And there is a cyclist NGO in Quito in Ecuador that they were facing, they had the open streets for several years, and the new authority were considering to remove the open streets because they didn't find that the open streets actually provide many benefits and only include some costs. So they needed a way to show up the case that this is not only a leisure physical activity, if not also is health. So they want to make the link between open streets and health. So this is a citizen science project, and we were contacted through the Habitat 3 conference that we were in Quito in Ecuador. So the overall umbrella of the project is Inspires, and Inspires is a project that includes different citizen science projects around the world. In this case, the NGO in Quito helped us to connect with the Red of Ciclovías Recreativas de las Americas. It's a network of open streets in Latin America that combines all the managers and all the authorities related with open streets in Latin America. That it's a great network to actually access the data. So we prepare some data collection and surveys to actually collect information about the different characteristics, users, length, frequency of open streets in different cities. So, and we were able to actually translate that in health outcomes. So overall, what we found is that each year, the amount of physical activity that is performed in those open streets in Latin America among these 15 cities can prevent and reduce more than 180 deaths each year. So that means more than $500 per year disability years to life years, and that means more than 260 million US dollars per year. So this is tremendous health benefits related with open streets. And that provide to the stakeholders and the NGOs and the network of open streets in Latin America value to actually defend and advocate for this kind of interventions. So we also try to assess different policy scenarios. What if those open streets were more successful in the future? What we found is that among these 15 different cities, the most successful open street was in Bogota. They have a lot of people, many people in the city and the communities actually use the open streets. So we modeled what if all these 15 cities go as well as Bogota. And we find that if all these 15 cities goes as well as Bogota, they can be reduce or prevent or postpone more than 8,000 deaths per year. That means more than 12 billion US dollars of benefits of those open streets. So you can see here the different benefits of the on mortality between the users between the 15 cities, and this is related to the health economics benefits if they go to the best case scenario, that is Bogota. So it is a lot of benefits, a lot of potential and opportunities here as open streets and intervention to actually improve urban environments. So some challenge that we face, and you can see here is the distances, the kilometers that each open street in each different city currently have. So there is a lot of variability. So there is a lot of opportunity to improve. Most importantly, this is the amount of participants per day in each of those cities. So you can see that the kilometers do not match with the participants. So that is something that was very interesting for us and something that cities and authorities and open street managers have a lot of room there to improvement. And when you compare what is the proportion of people living in those cities that actually use the open streets, you also see a lot of variability. So that means that in the best case scenario in Bogota, 13% of the people living in the city use the open streets. So, and many of the others open streets are not so successful yet. So there's many room of opportunity there of improvement to actually attract, and the interventions already exist. So we find that there is a challenges and things to improve, but currently the open streets already provide health benefits. So what are the next steps? Of course, expand this type of analysis and connection with different stakeholders, not only in those cities. There are many more open streets in Latin America, but unfortunately, we're very hard for us to find the data to actually provide this quantification. So we're happy to connect with new collaborators and find new funding to actually expand that, not only in Latin America, but also other countries in the Americas. Continue advocating for open streets in general, but also for improving the quality of data and data availability. We are waiting to publish this very soon, but in between we have this policy brief in Spanish that you can actually access in this website. And the next steps also is provide more health benefits or other climate mitigation strategies, specifically at the urban scale, but also at the national scale in terms of policies to promote walking, cycling, public transportation, but also change the land use, like increasing green spaces or densification of cities or reducing air pollution. So there is a lot of opportunities there to actually connect health, public health and climate mitigation and adaptation. So thank you.